Hi, everybody. We're going to just say a few words about skin health. We talk about heart health. We talk about, building strong muscles, building strong bones. But how about strong skin as an organ? We could talk for hours as dermatologists, really, on the skin and skin health.
We certainly can. And it's interesting because, there's a lot of attention about skin beauty, right? So making it look good and smooth and kind of shiny. And we all know what beautiful skin looks like.
And that there's a crossover every day in our clinic, in the medical dermatology to the cosmetic dermatology. The healthier your skin medically, the better your skin aesthetically as well. There's a complete crossover there.
There certainly is. And it's very interesting that when people come in feeling, oh, you know what, I look a little bit saggy, I look a little tired, my skin is just very dull. And, we step back and it's like, well, we need to improve your skin health, right? And then really beautiful skin is healthy skin.
So we've got the barrier. So we need an intact barrier of the epidermis. It can be looking too dull and gray with too many dead skin cells that are sitting on the surface. So exfoliation is a big step. And then that allows for a lot of our moisturizers and emollients to absorb well into the surface,
do their job.
into their job.
And then don't forget that as we're thinking about the surface of the very top layer of our skin, right, is the microbiome of the skin, which is something that, I think a lot of people are starting to learn about and read about, but it is really very important. And we see that as dermatologists. In fact, as people are, diving in and buying a lot of this, that, and the other in terms of their skincare, their makeup, we see certain conditions that come up where there's inflammation triggered because the microbiome of the skin has actually been disrupted. And so sometimes as, we first take on a patient, the first step is actually getting their microbiome of their skin back in order. Because until we do that, there's going to be inflammation that is in their skin. And we know that when there's inflammation in our tissues, there's going to be an ongoing destruction at the microscopic layer.
It's very complicated. It's micro-regional as well.
Yes,
that's for sure. You can have problems happening, say, just around the mouth, but not on the cheek. You can have problems on the hairline, but not on the rest of the body. Yeah. So it can be quite complicated.
Yeah. So sort of that's the microbiome of the skin. And then you go a little bit deeper. So we have, for example, the vasculature. So all those capillaries and the blood vessels. And we know genetically there's huge differences in how people's vasculature changes with age. And then there's conditions, for example, like rosacea. There's environmental exposure. So people that are in the hot or in the cold for a prolonged period of time. So if you have that combination of genetics and environmental exposure, you can see those vessels, so the capillaries and the veins, they become enlarged. So people look red, they look a little bit puffy, they can get red vessels around the nose, they can get darker blue looking veins around their eyes. And so all of those changes that compound, right, with every advancing year of age, they make somebody, again, it detracts from their skin health, and therefore it detracts by the beauty of their skin.
A lot of our procedures, as a secondary effect, revamp and revitalize that capillary structure in the skin.
Right.
It's often not talked about as enough, maybe.
Yeah, well, it helps kind of shrink down that vascular network that might be too large, right? So imagine it's almost like, again, I love my analogies. It's like a pair of Lycra pants that have got lost that elasticity. So we're trying to get those vessels back to a healthier size. So to have the proper structure within the skin. Along with that is that, again, to our customized treatments is that often patients really need a combination. So we're treating their veins with a combination of different lasers depending on the depth and the type of vessel that's involved. But then we're also combining it with medical treatments. So often compounds that may include antibiotics to help control rosacea, and also the appropriate skincare. So the over-the-counter medical grade skincare to help control this and help keep it to a minimum over time.
Yeah, speaking of medicines, we often give low dose or ultra micro low dose Accutane, just as a little bit of control for those patients who find themselves just a little over oily, just to give them a little bit of support. I often describe to my patients, if you had a sore knee and you wanted to go on a hike, you would put a knee brace on. Yeah. So it's bracing and helping your knee to support you in what you want to do. That's the way I like to see the use of low dose Accutane. It's just supportive so that patients can get on with their day. their normal function and feel confident.
And then let's talk about pigment, right? So we talked about vessels, right? So the redness, the blues, the reds that we get. Let's talk about pigment. And that's a huge category in and of itself.
So the number one culprit of dyschromia, which is just a fancy word of saying that your
color is off.
Is off. Yeah, it's not your normal color, is sun, UV, UV exposure.
And I think, our audience is pretty sophisticated. Everybody knows now the importance of sunscreen. I think that's been drilled into everybody's head. But often we're kind of looking at damage that might have been caused as a teenager, right? So, or even as a child. I was just with a friend of mine who's a dermatologist this weekend, and he was saying that they would go to the beach every summer, and his mother was like, oh, that sunburn is okay. It's good. You're getting, your skin is going to get strong and tough.
Base layer.
Yeah. And now, 40 years later, he's still trying to correct all that damage being done. So not to say that there's never a good time to start doing your sunscreen, because absolutely we see people that start being really vigilant in protecting themselves. The amount of dyschromia, so these abnormal pigments, will decrease over time. But sometimes we just need to kind of jump in there and help correct old damage. And then there's conditions like melasma, right, which are far more complex. Melasma is really this abnormal pigmentation, again, typically seen in patients that have had a lot of sun over their lifetime, but there's other factors. So we know there's hereditary factors involved, and there's also hormonal factors involved. And so melasma, for example, has really a different set of protocols and a different approach.
So melasma, as we know, is extremely difficult to treat, and we're often faced with a multi-modality, multi-ingredient combination approach, and it can improve greatly. It takes time. That's the approach in our clinic for those really tough cases. And I know there's a lot of tough cases out there. And
difficult condition, but
difficult.
there are really a lot of things that can be done to help improve.
Yeah, we've seen a lot of good turnarounds in the clinic this year, I would have to say.
Yes, absolutely. Okay, so we've hit the epidermis, the vessels, the pigment. Let's talk about the ECM, so the extracellular matrix, and inflammation that happens, right? So that's another part of skin health, is really making sure that inflammation in our skin is kept down to a minimum. So sometimes we see inflammation in the context of skin disease. So things, again, like rosacea, like acne, things like psoriasis, eczema is a big category there. It's very important, again, as we're addressing skin health, that we make sure that we keep that inflammation to a minimum.
There's some exciting new medical trends in the prescription medical realm as well this year that came out. Some fantastic advances that are non-steroidal. They're out of that group of medications that can have some side effects that we have to be very careful of. Still, steroids are very helpful, but the non-steroid realm is really coming in medical dermatology.
It's actually so exciting, right? As a dermatologist, because honestly, for years and years, all we ever had were topical steroids, and always a priority was to clear the inflammation. But steroid use, especially on the skin, over time will actually thin your collagen layer. So we always felt somewhat compromised that yes, we need to treat the inflammation, but we don't want people, we don't want them to destroy their collagen in the process. So just really in the last year or two, we now have all sorts of new options of medications that are so safe to use to clear that inflammation.
And the patients are getting fast results.
Amazing results.
And then the goal is to have disease-free days decreasing over the course of a year. So some of these reactionary inflammatory processes in the skin, we don't cure them, but we manage them and control them so that they are as limiting as possible for the patient and their experience in their day-to-day life.
It's actually really amazing. And I have to say, we are super lucky as dermatologists that we can treat people with inflammation with a cream that has so few side effects. Like imagine if we had something like that for people with arthritis that have inflammation in their joints, that you could take something with really no side effects to nab out all of that inflammation. So there's inflammation. Okay, other components of the ECM. Well, let's talk about collagen, one of our favorite topics.
Go see the other 20 videos.
More and more and more. Yeah. So, of course, part of maintaining skin health is doing what you can to boost your collagen layer because we know all the factors. So, there's genetics that are involved, there's environmental exposures that are involved, there are other, systemic health issues that can deplete our collagen over time. There's sunshine.
Number one, advanced aging process is just too much sun and it goes deep.
That's another thing that we look at, right? When we're looking at skin health. So sometimes we see people and we're like, okay, your vessels are good, your pigment is good, you're not inflamed, fantastic, check, check, check. But it's really now your dermal layer, where the collagen lives is just too thin. You're getting too crinkly. So that's when we sort of look at treatments or options to help boost that collagen layer.
Mm-hmm.
And again, it's like multifold. So there's things that you can take like supplements, like collagen supplements that you can take. There's lasers that we can do that will like boost the body's ability to create new collagen. There's skincare things that we can do. And of course, all the natural regenerative things like PRP and PRF.
So lots to do. And then if we're in a good position with good skin health, looking fantastic, you have many more options to proceed forward. When you want to, you'll get better results. So you have better skin, your Botox results are better. You have better skin, your filler results are better. You have better skin, your laser results are better. You have better skin, guess what? Your facelift.
Yeah.
And your brow lift is better. So working on your skin every step of the way, 20s, 30s, 40s, 50s, it makes sense. So you put in the work, you pay attention to that skin health. It's the most exciting organ on the body. And then if you decide you're gonna go for a little bit of a nip tuck someday, because a lot of people are, you'll get better outcomes.
You will. But
all the plastic surgeons are talking about that.
Yeah.
Actually, we've been at several different conferences or had one-on-one chats with plastic surgeons where they will not operate unless the patients are willing to do a 6-month skin prep ahead of the surgery, because they know that they'll get better outcomes.
Yeah.
So newsflash.
Let's just do a little bit of a deeper dive into plastic surgery. These are all tools, right? All these procedures are all tools. And it's really not about the one thing in particular. It's really how everything is combined. Mm-hmm. So 2025, we saw some really amazing influencers on Instagram like Kris Jenner, right? Who had fantastic results with her facelift, which is great.
Yeah.
But I think it's really important that people understand that, what you're seeing there is the end result of a lot of lead up, right? So it's years of taking care of your skin. So proper products, proper lasers, proper tightening devices, things that optimize your collagen layer. It's like a building. And then yes, the surgery at the end, obviously it's fantastic to be able to pull the deeper layers to get lifting when you need to, but it's the combination of all of it. So mm-hmm. it's like there's no shortcuts. Let's say Kris Jenner hadn't done all of those other things leading up to it and she just went in for the facelift. Guarantee you wouldn't have seen the same result.
Exactly.
And now we're seeing really a lot of our surgical, like our plastic surgeon colleagues reaching out to us and asking to collaborate together. So they're getting patients that want to do these procedures, but they understand that you really need to have healthy skin in order to optimize the outcome, mm-hmm. right? So if you take unhealthy skin and you pull it tighter, well, you're still going to have an unhealthy look.
There's a few patients, they think that facelift or that one surgery is gonna be the miraculous finish. That's when they cross the finish line. But the concept is extended. It has a longer lifetime than that. Yeah. So even if you do the facelift, you still might have to do a fat transfer, a volumization, some lasers to keep the skin taut and tight and healthy and radiant. I've also heard some plastic surgeons quote patients just on the type of skin that they have. So if there's a real lack of elasticity, sometimes those facelifts, they will say, oh, I think the lifetime is about 5 years or 5 to 7 years. Yeah. And then you'll have to go under the knife again if you want.
Exactly.
Which is it's a big step. Well, it's a very big step.
It is. Mm-hmm. It is. And that's for sure, right? So there's the longevity of the facelift. And then this whole idea, like I've had some patients that come and say, oh, I think I'm just going to wait. I'm not going to do anything. I'm just going to save it up and do a facelift when the time happens. But then you're like, no, it doesn't work like that. It's like, It's like you can't not work out for your 20s, 30s, 40s, and then arrive at 55 or 60 and just say, okay, you know what? I'm going to hire my trainer now and everything is going to be perfect. Unfortunately, it doesn't really work like that.
Okay,
So,
wow, skin
skin
health.
health, big topic.
We only had 20 minutes, but we could have been here for hours.
Hours and hours, right? So there's not like, there's not a one size fits all. It's not a one video. It's not a one product. It's obviously it's complicated, but there's so much that can be done. So the whole key is really to get good advice, know where you're getting your advice from, so you know you're not wasting your time with things that really are not going to be helping you, not just today, but in the long run.
The best advice is to protect, prevent, and just get started.
Exactly.
With a few elements. It doesn't have to be overly complicated.
Yep.
Everything.
Just get started wherever your comfort lies, right? It's like, how do you run a marathon? Well, it's one step at a time. Thanks everybody for watching. If you have any questions or comments regarding skin health or anything else that you might have watched on the channel, please let us know. We're here for you, and we really want to make this relevant and answer any questions you might have.
Yeah, drop your comments in the section below, and yeah, thanks for watching. We'll see you next time.
Great. Thanks, everybody.